Hey y'all, it's Kosta. I help people break the system to build a better future. Today we're talking about if COVID-19 could improve the long-term care industry. While the world is reopening and life for those vaccinated has returned to a new normal, many nursing home residents are still living under lockdown after lockdown. A single COVID-19 case in a nursing home can trigger a 2-week lockdown for all residents and longer if cases have spread. Long before the pandemic, there were questions about the quality of care delivered in long-term care facilities, but throughout the pandemic, the vulnerability of nursing home residents has become ever more apparent. Due to the communal nature of long-term care housing and how closely residents interact with rotating caregivers and staff, residents and staff were among those who needed the most protection in the face of this pandemic. However, they were often last on the list of those to receive it, which is crazy, right? Across the United States, there's widespread understaffing and a lack of personal protective equipment in nursing homes. Two areas of neglect that were later shown to be key drivers of spread in long-term care facilities. Nearly 31%, or roughly 1/3 of COVID-19 deaths in the US are linked to nursing homes. In 5 states alone, the number of deaths of nursing home residents due to COVID-19 accounts for either half or more of all recorded fatalities. While the fatality rate for COVID-19 across the US hovers around 2%, in nursing homes, the rate is significantly higher at 10%. A reckoning with our failures over the past year may help us improve nursing home care in the years to come. The challenges to delivering higher quality care have only grown. Nursing home costs have skyrocketed due to the pandemic, with exceeding numbers of for-profit facilities no longer able to keep up. Demands for personal protective equipment and other needed supplies have driven part of the increases in cost, but the real burden is the demand for additional staff to provide better care. Prior to the pandemic, many nursing homes weren't meeting Medicare's minimum staffing requirements to even begin with, which are undoubtedly one of the key factors in determining a nursing home resident's quality of care. Today, with the failures of the past year, nursing homes have been asked to not only meet those requirements, but ensure there are necessary staff on hand to ensure these requirements are met even when a number of staff are out on sick leave or required to quarantine due to exposure to COVID-19. Some smaller foundations have provided grants to improve the quality of care delivered to patients in long-term care facilities. The Hartford Foundation recently released a free COVID-19 rapid response network for nursing homes across the United States. This program offers homes that are certified in Medicare and Medicaid programs the opportunity to participate in a training course with immediate access to specific, pragmatic guidance from federal and state policymakers on clinical and operational issues confronting the nursing home community today. The American Healthcare Association and National Center for Assisted Living is pushing for an increase in reimbursement rates for nursing home services offered by Medicare and Medicaid. As of 2020, Medicaid remains the primary payer for nursing home care, covering more than 60% of all nursing home residents. Medicaid reimbursements in turn cover 70 to 80% of the total cost of nursing home care, leaving a large gap in funding. As costs rise due to COVID-19, federal payments are falling woefully short of what nursing homes need to provide a higher quality of care. While Americans wait for changes in the nursing home industry, many are choosing to take matters into their own hands and care for their loved ones at home. The pandemic has created an explosion in demand for at-home caregivers, with the workforce expecting to increase by more than 1/3 by 2029. And I believe when done correctly, in-home caregiving can offer the highest quality of life for those in need of care and will continue to progress as the primary form of care for the future.